I'll just wait for everybody to sign on again. So grab yourself a tea or a coffee. Maybe I'll just take a couple of our Facebook questions. Judy just signed on Instagram. Judy, just let me know if there is sound now on Instagram or if anybody's following us on Instagram. Just a thumbs up if you're on Instagram to let us know that everything is working okay on your end there. Yeah, we're good. Okay, sorry about that, guys. I don't know what happened. Sometimes it's system's glitchy. So it just killed the volume over there. So we're just going to let everybody jump back on. Oh, good. Everybody's okay for sound now. So we're just going to let you all jump back on and then we'll get started. The topic this week I'll just start chatting about is whether or not birth control pill prior to in vitro fertilization or even IUI makes a difference or decreases your chances of success. I think it's kind of a real important topic because some places use it, some places don't. The part I was talking about that you folks on YouTube and Instagram and Twitter couldn't hear was that I was thanking all of the nurses. So this is International Nurses Week and Canadian Nurses Week, and I just was expressing my deep appreciation for our own team of nurses, our staff, all the ladies here that help us out, and then, of course, all the hospital nurses as well, all the frontline folks, in particular here at Windsor Regional Hospital. They had done a tremendous service for all of our patients and for me as well, because I actually was in the hospital last Sunday getting my kidney stones removed and then had to go back on Tuesday morning, right after our show the next day, when they removed my stent, my ureter occluded, and that was not a fun time. So it was quite uncomfortable, and the nurses there took amazing care of me. So thank you to all the nurses out there, and thank you for all the stuff you guys do. You guys are amazing. We really appreciate it. Okay, so hopefully everybody is back on board. I do see some questions coming up. I will definitely try and touch on all of those. And let's get started. So the topic this week is very important because it just came out the other day in the journal Human Reproduction. And it's about a very long-standing controversy. So I thought it was perfect for Fact or Fiction. So the question is, does the use of birth control pills, oral contraceptive pills, prior to fertility treatments actually alter your success rates in terms of outcomes, live birth rate, clinical pregnancy rate, miscarriage rates, and so on? So this has been controversial for a long time because there were studies in the past that said it was actually beneficial to be on them. Then there were studies that said it didn't make a difference. And then somebody piled all of these studies together. And when they piled all of these studies together, they said, wait a minute, it actually looks in a meta-analysis done back in 2010 and then repeated in 2017 that maybe it could have an adverse impact, that it's actually a negative. The problem was the analysis was very confusing. They pooled together the clinical pregnancy rate and the live birth rate instead of separating them into separate issues because they're not the same thing. Clinical pregnancy rate is when you're looking for a heartbeat on ultrasound, and live birth rate is actually having a baby. So there were two very different issues that people were exploring. And then on top of that, the other thing that was really critical was that the outcomes of the studies that they were looking at and the procedures and the birth control pills and all of that stuff were very, very different. So there was not one well done sort of long study that looked at lots of patients. It was a bunch of smaller studies. And when they analyzed it, they used kind of strange methodology. So no one was really convinced that that data was correct. So the new study is called The Effect of Type of Oral Contraceptive Pill and Duration of Use on Fresh and Cumulative Live Birth Rates in IVF/ICSI cycles. So this is published just this month in Human Reproduction, and it's part of their advanced access. So it's not even out in actual formal publication. You can only get it digitally right now. And this is free for everyone if you ever want to sign up for Human Reproduction. It will likely bore you to tears unless your job is like mine. But if you do like reading this stuff, by all means, it's a great way to learn about the frontline medicine of everything that's happening in reproduction and infertility. Okay, so this is a Spanish study. It was done in Barcelona, Spain, where my sister lives actually now. So hi, Venus. Hope you're well. And you hopefully are asleep at this hour. So it's a retrospective study. So let's deal with the main issue here. This was not a study where they were looking forward in time, which is a prospective study. And when we grade studies, prospective randomized controlled trials are always the best, and retrospective studies are definitely a lower level of evidence. So this is a big study, and I'll get to that in a second, but it is retrospective. So they went backwards in time and looked at their data. It wasn't, hey, let's start from now and monitor what happens to all of our patients, which is the best way to do your research studies. So the time span used was from 2009 all the way out to 2017. It was all done in one center, a university hospital in Barcelona. And they looked at patients who exclusively had undergone IVF or IVF with ICSI. So the grouping was anyone from 18 to 45 years of age undergoing their first ovarian stimulation cycle. They were using a gonadotropin releasing hormone antagonist protocol. So those of you who are in North America, that's usually going to be either cetrotide or orgalutran. We use a lot of cetrotide. And then they were all included. The patients had all causes of infertility. So tubal factor, male factor, endometriosis, unexplained, even diminished ovarian reserve cases and mixes of those. And they followed all of the patients out to 2 years past their actual cycle to see how they did and where all of the results were. And how many pregnancies that they had and live birth and so on. So it was all based on the first pregnancy. They weren't looking for multiple pregnancies. It was time to a first pregnancy and then outcome of that first pregnancy. All of the patients got birth control pills versus the non-pill group. So there was two groups of patients. Obviously, some received it, some didn't. And the ones that did get it had it for anywhere from a minimum time period, and I think they specified 7 days, all the way out to a maximum time period that was 30 days. And they all started their stimulation 5 days after they had stopped the oral contraceptive pill. So those are all really important time spans and points. Sorry, it was from 12 to 30 days, not 7 to 30 days. So they started the pill 12 to 30 days before they did their cycle, and then they stopped and waited 5 days, and then they started their cycles right after that 5-day period. And they focused on only two types of oral contraceptive pills. So one is what we call here Marvelon. So that contains ethinyl estradiol at a 30 microgram dose, so it's like a medium dose pill. And then they used desogestrel in there as well, which is the progestin at 150 micrograms. And then they used another pill, which is essentially Yasmin, which we really don't use very much anymore, but it is still available. And that's 30 micrograms of ethinyl estradiol. And then this really neat progesterone called drospirenone, and that has 3 milligrams of drospirenone in it. And that's a 4th generation progestin with very anti-androgenic properties. So it actually fights off some of the sort of testosterone and androgenic effects that many women have. It's a pill we frequently use in women with polycystic ovarian syndrome. So the only people that they excluded were patients that were going through PGT-M, which is when you're doing pre-implantation genetic screening for a monogenic disorder, or PGT-A, so all the patients that actually were freezing immediately their embryos because they were doing genetic screening, the ones that were just doing egg donors or social egg freezing. So those patients were excluded, and that makes sense, but they included everybody else. Okay, so what did they look at? Well, let's look at the study population. So overall, they had 4,116 patients. So that's a fairly sizable study. Certainly in the IVF world, anytime you're getting past hundreds, you're doing a very good job. And when you're up into the thousands, you're doing an amazing job. So this is a pretty robust database. So the average age of the patients, no difference between the two groups. There was 3,517 patients that did get birth control, 599 that did not. Average age 36.8 in the one group, 36.9 in the other, so no statistical difference. Most of these patients were quite healthy. Their body mass index was only around 23. I guess women in Barcelona must keep their body mass index fairly low. Their AMHs were in a reasonable range, 1.72 and 1.39 nanograms per mil. There was a slight difference between those two outcomes. So the group that did get OCP did have a slightly higher AMH level. The antral follicle count was higher in the oral contraceptive group, but only by 1 egg, so not really substantially clinically different. And then the fertility diagnosis was about 30% female, 25% male, 11% mixed, and about 36% unexplained. And it was fairly similar in the non-birth control group. So very similar sort of numbers and data there for everyone to look at. So the question was really, what were their outcomes like? So when they analyzed the outcomes, the first thing they looked at was what was the duration of stimulation required to get patients to the egg retrieval stage. And what they found was there was a slightly longer duration of stimulation in the group that got the oral contraceptive pills. So it's 10.1 days versus 9.25 days in the other group. So, did we lose sound again, or can you still hear us? Because something just showed up here, sorry. So a little bit longer in the stimulation phase. The other part was that the total dosage required was higher in the birth control group than the non-birth control group by about 200 units. So roughly like half of a pen or close to 2/3 of a pen of Gonal-F or Puregon or whatever you're using. So they then looked at the number of eggs that were retrieved, and there was actually one more egg in the birth control pill group than there was in the non-birth control pill group. So the group that did get the birth control pill actually produced a slightly higher number of eggs. Again, I'm not sure how clinically significant that is. The difference was between 8.9 and 7.5, but it's almost 1.5 eggs. So that does make a difference to some patients. In other patients, it wouldn't make a huge difference. And then the other part was that they looked at the number of mature eggs. There were 7.1 in the birth control pill group and 5.9 in the non-birth control group. So again, slightly higher number of mature, and same thing with fertilization. They had more eggs that fertilized in the birth control pill group than they did in the non-birth control group. So overall, it looked like you were getting more eggs, you're getting more mature eggs, and you're actually getting a higher fertilization rate. When they looked at embryos that made it to the blastocyst stage, so those are the prized embryos for us because that's the day 5 embryo, which is more robust, has a better chance of working. They saw that 29.2% got there in the birth control pill group, but only 11.5% in the no birth control pill group. So this is very, very impressive because you're looking at, well over double, almost triple the success rate in getting to a blastocyst when you did use birth control pills. So they then measured the actual outcomes, and that's obviously the part everybody wants to know about. So clinical pregnancy rate, so seeing a heartbeat, was 33.4% in the birth control pill group and 33.4% in the no birth control pill group. So despite the slight differences in eggs and embryos and so on and fertilization, no difference in clinical pregnancy rate. They then looked at the live birth rates, and the live birth rates were 24.5% in the birth control pill group and 25.2% in the no birth control pill group. And that is, again, not any different. So no statistical significance between those two. And then they looked at the cumulative live birth rate. So this was over the 2-year time span, checking to see how patients did over that whole time with frozen embryos, with the fresh embryos. And in that group, they showed that there was 32.4% in the birth control group and 31.6% in the non-birth control pill group. And again, there was no difference. So they then took all of the data and they wanted to make sure that these findings were correct, even when they controlled for what we call confounding factors. So your age, your body mass index, your smoking status, your infertility diagnosis, how much dose you took. And they really did a good job of hitting every single important target in there. And even when they did that, they actually showed that there was still no difference in live birth rate or cumulative live birth rate when they controlled for every single factor that they could. So there was no difference between the birth control pill group or the not birth control pill group. So ultimately what they concluded was, based on their data, it does not appear to have a significant impact on success rates, regardless of whether you use birth control pills or not. So for patients that need to be programmed, either because of they're using a donor or they need a surrogate, or we're programming them in order to schedule things better, it does not appear to have any impact when you're using this reasonably short duration of birth control pill. And we use a lot of Marvelon and another one called Brevicon, which falls well within the same realm as the birth control pills that were used here. And so it does not appear to have any significant impact whatsoever. In fact, there may be a suggestion that it might be even a little bit better. And when it is giving you a higher egg yield and fertilization and blastocyst development, maybe if we have enough numbers and this is done prospectively, we may see some benefit. There are some things to watch out for. So there is some concern, although not good data yet, that in women that are older or over the age of 40, it may not work quite as well, because you can get a little bit of a suppressive effect if you're on the birth control pill for too long. And if you're on it for too long, that can actually interfere with how you're going to do in terms of response. And we did see that here, where they took a little bit of a higher dose in that one extra day to develop the eggs. So fact or fiction, is it true that birth control pill is detrimental to your cycle? It is fiction. It is not detrimental to your cycle, at least in the average patients that are out there using a reasonably short dose or course of oral contraceptive pills and then proceeding with your fertility cycle. For patients that do get excessively suppressed by it, that's a different story, and you have to individualize for some of those patients and watch them carefully. So that was Fact or Fiction tonight. I hope you enjoyed that part of it. I just want to reiterate, for those of you that may have missed it at the beginning, huge shout out to all of our nurses. It is International Nurses Week. And I just want to say thank you to everybody out there. So do you want to read off, or should I do it from here, or how should I do this? Yeah? Okay. So I will start taking some questions now from the Gram and YouTube and all those other guys, and then we'll go from there. Okay, and my apologies for the sound thing at the beginning. We always ask and then we go from there. Hi, Dr. Victory. Can you chat about the following? What are ureaplasma and mycoplasma? Do they have a significant effect on recurrent miscarriage? So ureaplasma and mycoplasma are specific bacteria. And in animal studies, they have been demonstrated to increase the risk of recurrent miscarriage. So yes, they appear to have an effect. In human studies, it's never actually been demonstrated, but all of us look for it and treat for it when we find it. So I actually was talking to my colleague, Dr. Pattinson, today about this, and we were discussing how we both test for it. So I've now adopted this new test called Locus Medicus, which does polymerase chain reaction testing, where they can actually look for the DNA of any bacteria or virus in the lining of your uterus. And it's pain-free because you actually just collect some of your menstrual blood. It gets sent off to Locus Medicus, which is in Greece. They can then analyze it using the test with the PCR, the polymerase chain reaction, and they will actually tell you if the